The most single-day deaths since early June. Roughly 2 people an hour died yesterday from the coronavirus as Maryland continues to see a spike in new cases and more than 2,000 in 24 hours. Hello, everyone. I'm Vic Carter.
And I'm Denise Copeland. Despite those troubling numbers, there is hope for the future. The United Kingdom has officially approved the Pfizer coronavirus vaccine.
It's the first country in the world to do so. Already, hundreds of thousands of doses are being shipped from Belgium to the UK.
As for here in the U.S., while vaccine candidates have been submitted to the FDA for approval, not one has yet received the green light. But that is not stopping officials from laying out plans about how the vaccine will be distributed, to whom, and who will receive the very first dose.
WJZ investigator Mike Helgren is following Maryland's vaccine distribution plan. He's live at City Hall with a number of developments. Mike.
Vic, Denise, we'll get to a fight over the South Korean tests that Maryland obtained in just a moment. But first, the vaccine, and the lieutenant governor warning Marylanders that the general public isn't going to get it probably for several months.
We expect that we will be receiving vaccines in the very near future.
Maryland's lieutenant governor says the first batch of 150,000 vaccine doses should start being distributed by the middle of this month, pending FDA approval. After frontline healthcare workers are vaccinated, the next group is at nursing homes.
Because the staff are the ones who are transient. They are the ones that we saw last spring that were bringing it in unintentionally.
Loyola University immunologist Dr. Chris Thompson is excited about the vaccine, but acknowledges there will be challenges.
It's 2 doses, so that's going to be challenging. We don't know the length of protection after you've received the 2 doses, so that could be challenging. And again, how do you pick and choose between which frontline workers get it and which ones don't?
The COVID crisis is getting worse, with Maryland reporting 2,220 new confirmed cases. The positivity rate rose above 7.5%. Baltimore City alone reported 9 new deaths. At a meeting of the city spending board, the city attorney praised outgoing Mayor Jack Young.
There is no mayor who has had to weather ransomware and then COVID. And you rose to the occasion. I will always believe that you saved many, many lives.
There are a lot of unanswered questions that I believe need to be clarified.
At the state spending board, the comptroller raised questions about almost $10 million in taxpayer money Governor Larry Hogan spent on tests from South Korea. The acting health secretary says the first batch was flawed and never used, and the state paid more than $2 million extra for replacement tests. The acting secretary revealed the entire purchase is now being audited.
At the time, because of the crisis we were in and we wanted the tests, and it's turned out to be a good thing we had them.
And the acting health secretary says that 430,000 of the 500,000 tests in the second batch from South Korea have now been used. He dismissed criticisms of false positives in those tests. Reporting live at City Hall, Mike Helgren, WJZ.